It is in fact the big international focus, the focus on coronavirus. Let's take a look at the very latest details on the global spread of coronavirus and the effect over here in India. Well, let's talk about India first. 3,935 people are under surveillance in 29 states and union territories. This is an all-India effort at this stage. The Health Secretary says that 89,500 passengers have been screened from 777 flights at 21 airports across the country. India has cancelled all visas from China issued since the 15th of this month. So we've cancelled all those visas of Chinese foreigners, anybody who's visited China in the last 2 weeks and wants to come across to India. Those people travelling and residing in India with a regular e-visa, well, there are conditions for them as well. They are required to get in touch with the Ministry of Health. So if you have an e-visa, you came into our country within this period of time, you are a Chinese national or somebody who's visited China in that time period, please get yourself checked out. 8 people in Cuttack admitted in hospital. Blood samples have been sent for tests. There are other tests which have also taken place. I can also share with you that the facility in Manesar in Delhi, there were samples which were actually sent for testing. These are the students who came back from Wuhan. So far, all negative. So those kids are all right. Dr. Anand Mohan, Professor and Head of Department Pulmonary Medicine at the All India Institute, joins us now. I think, Dr. Mohan, there's a great deal of confusion about how dangerous this can be. Is this like any other cough and cold? What makes this worse and more dangerous than other such ailments?
If you go by the symptoms of the coronavirus or the novel coronavirus as it is called, it is very similar to the symptoms that we see in most of the other viral infections and the colds. It is very similar to the common cold that we have. It has flu-like symptoms. Patients may have a variety of symptoms like runny nose, they may have cough, they may have sore throats, they may have headaches, they may have fever, sometimes they may have body aches. So most of them are very, very closely similar to all the other symptoms that we are so used to having. Hence, just by symptoms we really cannot decide whether it is a coronavirus or some other of the many other viruses which cause respiratory infections. The only thing is that as far as the data which we have, it has a fatality rate or the mortality has been somewhere around 2% or so. So there have been instances where it has led to more severe infections, much more severe respiratory distress, pneumonias and deaths as well, as we know. So that is the cause of concern. Otherwise most of it has actually resolved on its own, just like most viruses. But there have been deaths and that is why it's a cause of concern.
Doctor, correct me if I'm wrong, but viral infections like this, often medication just simply doesn't exist. What would be the process for there to be some sort of a cure or some sort of a relief for this particular virus? Would that be a very lengthy process or would it be impossible in any case?
Well, it is true that viral infections by and large do not have any treatment except for certain viruses, but coronavirus and the type that we are seeing right now does not really have any definitive cure as such. Most of the treatment remains symptomatic, so one will have to kind of give analgesics, give the symptomatic medicine for the sore throat, the cough and the fevers, and then over a period of a few days to maybe a week or so, most of the time these viruses and the symptoms subside and the viral infection also subsides. So that is probably how it is going to be. And personally, I don't see any real cure for this particular virus emerging in the very near future, because these are long processes. One has to understand the makeup of the virus and one has to understand how these viruses behave, and then so that's a pretty lengthy process. One really doesn't expect a medication to emerge so soon.
And doctor, as a practitioner yourself, if a patient comes to you anytime and you know that this is spreading around the world, what are you looking out for when you ask somebody to go test?
So of course, one thing about this virus is that it has a pretty long incubation period. Incubation period means the time from when the person gets the infection to the time he starts showing the symptoms of the disease. So it is almost somewhere around 2 to 11 days for this novel coronavirus, probably even up to 14 days. So that again is a cause of concern. It means basically that even after one is infected, he may not show any symptoms for as long as 11 to 14 days. During that time, he would be moving around everywhere, he would be interacting with people. So there are real chances of spreading the infection to other people. If we encounter this kind of a situation with all these symptoms, a travel history would be important. In this current scenario, anybody who has made international travels in the last 2 weeks or so, probably those would be the people whom we should be isolating, we should be keeping under very, very close surveillance, and we should be trying to kind of separate them from their family members, from the general population at large. And again, the process of surveillance then goes back from them to try and find out with whom they have contacted. So that is how this whole process multiplies.
Well, Dr. Anand Mohan, Professor and Head of Department of Pulmonary Medicine at All India Institute of Medical Sciences, one of the senior most doctors in the country in this department. Good to hear from you, and I think the message you would share is that it's important not to panic and that there are experts who are dealing with this. Thanks very much, Doctor, for being with us. We are completely out of time on this episode of Trending. There's a lot more coming up on NDTV 24/7. It's time now for us to take this short break.